For many decades, brain injuries have been diagnosed as mild, moderate, or severe using the Glasgow scale. But recently, the Brain Injury Association of America has collectively agreed that those classifications are outdated and even harmful for those survivors of brain injuries. Hi, I'm Dr. Brody Miller, PhD in Brain Injury Research and Rehabilitation, and in today's video I'm going to talk about the pros and cons of using classifications, as well as my own story and how it impacted me and what I think we can do as a society moving forward. First of all, the truth is that every single brain injury is unique because all of our brains are extremely unique biologically. Yes, they're all the same in how we evolved over tens and hundreds of thousands of years, but they're different just like a snowflake. And each brain injury is unique in its own way and how it impacts that individual. Now, let me tell you something about classifications and diagnoses since we're on the topic. In my own story, I was told that I had a very severe traumatic brain injury. Doctors told me that my brain was broken and that I needed to be on medications for the rest of my life and that I needed to learn to live with it and accept that. Now, the sad fact is that when an authority figure like a doctor tells you that your brain injury is severe and that you need to learn to live with it, it puts you in a box, it puts you in a label that you're not quite able to get past because you look up to this person and because they know what they're talking about. Now, that was not the case for me. I'm no longer on medications, I no longer have seizures, and my focus and concentration is better than it's ever been before. But the issue is because of what is called the placebo effect. And the placebo effect also has the alternative called the nocebo effect. So if somebody gives us a positive suggestion, especially authority figure, we're tending to lean towards that and believe that. But if they give us a negative suggestion called the nocebo effect, it also alternatively affects us deeply psychologically. And so this topic is very close to my own personal story. But the fact is, I'm going to also talk about the positives of giving a diagnosis. Because when you think about measuring your brain health and how it's functioning and connecting, when you put in EEG or you do a brain scan or a functional MRI, it is sort of like getting on the scale and checking your weight. You kind of need to know where you are starting from in order to reduce the amount of pounds that you're carrying. And the same is true with the brain. We need to know what's going on and how we can start to change those connections and results. So that is the pro side. So we need to balance those two thinking patterns. Of course, we don't want to give people limitations, but at the same time, it's great to know where we are in a baseline, how the brain is functioning, how the attention span is, how it's processing information. That way we can improve it. So what I would say is that when we can use scans, that is a good thing, but we have to be very careful with the wording. Like you need to learn to live with it, or you're always gonna be on medications, or your words like that are very disempowering from this perspective. And think about all of the people that are suffering from a traumatic brain injury, including our veterans out there. Thank you for your service. And I want to tell you that if you're experiencing depression, memory issues, and you're not quite feeling like yourself and you never feel like that you'll get back there, it's totally possible to recover through the empowering science of neuroplasticity. It was the same key that unlocked my changes and how I learned that the brain can adapt in response to all that we do. And it is far more resilient than you've been told. And I want to say from the bottom of my heart to you that you just have to start with small baby steps and improving in the right direction, and wonderful things can happen. Does it happen overnight? Usually not. The brain takes time, just like a muscle that needs to be strengthened. It grows, but it also atrophies as well. So it is a use it or lose it mechanism. So if this video impacted you deeply, I want to invite you to our group community, and I'm going to give you a free trial for a limited time only to join our community and give it a try, where we have support, we have brain gym exercises every week, we do breathing and meditations, and the group is a very collective, tight-knit group. So if you want to do that, here you can click on the link down below. And I'm wishing you all lots of love and peace in 2025, and we'll catch you on the next video.